False Belief Task, Lilia Edith Ruiz, Fall 2015. General topic. The article I chose from the textbook concerns development, specifically the subjects of child attitudes, cognitive development, cross-cultural differences, developmental stages, theory of mind, and false beliefs. The article study used a single procedure to measure false belief understanding in 5 cultures: Canada, India, Peru, Samoa, and Thailand. With a standardized procedure, they found synchrony in the onset of mentalistic reasoning, with children crossing the false belief milestone at approximately 5 years of age in every culture studied. The meaning of this synchrony for the origins of mental state understanding is discussed. Empirical article. The title was Synchrony in the Onset of Mental State Reasoning, Evidence from 5 Cultures. There was many authors including Callaghan, Rochat, Lillard, Clocks, Auden, Itakura, Tapania, and Singh. The reference was from Psychological Science, Volume 16, May 2005. Introduction. Over the past 20 years, developmental psychologists have shown considerable interest in the onset of a theory of mind, typically marked by children's ability to pass false belief tasks. In Western cultures, children pass such tasks around the age of 5 years, with variations of the task producing small changes in the age at which they are passed. Knowing whether this age of transition is common across diverse cultures is important to understanding what causes this development. Cross-cultural studies have produced mixed findings, possibly because of varying methods used in different cultures. Hypothesis. The basic question in the research is how children come to take the mental state of other individuals into account when making judgments about their behavior. Methods. The research was conducted in 5 cultural settings: Canada, Peru, Samoa, India, and Thailand. In Canada, children from a rural town with middle income and a variety of private early education programs were tested in a preschool. In Peru, children from a rural Indian town were tested. The socioeconomic levels were low relative to Peruvian standards, but private and public early education programs were common. Although children in the Peruvian schools were typically administered tests in a group setting, children nevertheless showed a willingness to play the game individually with the 2 researchers, who were introduced as teachers. In Samoa, children from traditional Polynesian agrarian villages governed through a chief system were tested in preschools or their homes. As for the Peruvian children, the Samoan children were unfamiliar with special individualized tasks in an educational setting. In India, children from a high formal regimented private school with middle socioeconomic standards were tested the false belief task in a quiet room or hallway outside their classrooms. In Thailand, socioeconomic status of children was low by Thai standards, even though the school was in the relatively affluent university neighborhood. A false belief task involving location was used in all settings. The task, a simplification of the naturalistic task used by other researchers, involved an experimenter hiding a trinket under one of 3 bowls, then leaving the room. Children indicated their choice by pointing. All sessions were videotaped and later checked for reliability. As in traditional false belief location tasks, a child was scored as having passed the task if he or she pointed to the location where the experimenter who left the room had hidden her trinket, and as having failed if he or she pointed to the location where the trinket was moved in that experimenter's absence. Results. Separate sign tests were conducted on the pass-fail frequency data from each culture, as well as on these data combined across cultures. Table 1 presents the data along with the probability levels for the sign test. From the table, it is evident that in all 5 settings, the majority of 3-year-olds failed the false belief task, and a majority of 5-year-olds passed except in Samoa. In all settings except Samoa, where most 4-year-old children failed, 4-year-olds were fairly evenly split between those who failed and those who passed the task. The data for individual cultures are mirrored in the data combined across cultures. Scientists of the combined data revealed that the majority of 3-year-old children failed the task. Approximately equal numbers of 4-year-old children failed and passed, and a majority of 5-year-old children passed. Conclusion. The results align with findings from studies using a variety of procedures with European and North American children, as well as with the findings from studies using the same modified procedure. The fundamental shift in understanding the impact of a false belief on behavior appears to be a universal milestone of development that occurs between 3 to 5 years of age. Synchrony in the age at which children of diverse cultures pass the false belief task undermines the claim that particular cultural views, such as a Western concept of mind, profoundly influences this very basic aspect of early mental reasoning, and strengthens the claim of universality. Whether the synchrony results more from biological maturation or from experiences that are universal across the cultures sampled, or both, remains at issue. Children are able to do the false belief task somewhere between the ages of 4 to 6, and children in some cultures are able to do it earlier than children in others. Advertisement. Description of the ad. The ad shows 2 different images when viewed from different angles. On the left side, it shows what an adult would see. It is a typical bottom sink cabinet with bathroom cleaning products. It has a product for cleaning the bath, disinfectant to put in the toilets, liquid so windows can be left shiny, and such. Each product has their own label. The right side is typical of a young child to see. The cleaning products from the left side were changed to portray the mind of a young child. The products were given shapes as toys. A round container was given the shape of an elephant, a bottle with a spraying ability was given the shape of a chicken, and a more simple container was portrayed as a baby bottle with milk. The right side does not include name tags on the containers. Both of the sides of the ad have a quote in common that says, "Children see things differently." On small letters, it has a message from the creators: "Prevent accidents, read the label." Analysis of the ad. The ad appears to be demonstrating the false belief task as it contrasts 2 different perspectives. The left perspective is of a typical adult, while the right side is more of a typical small child. As the quote on the advertisement says, "Children see things differently." The labels were taken off from the left to show that for a child, anything can be seen as a toy. The false belief task is not the same from the experiment, as the child did not have to pick from 2 boxes and guess where the adult will choose, but the technique still represents it, as it shows a false belief from children and adults. Just as children don't realize that other people don't see what they see, they also don't realize what other people don't know what they know. The advertisement is to aware adults that children don't necessarily read the label, so therefore we need to place a child lock on the cabinet to prevent future accidents. Children seem to get a hold of anything they set their mind to, and parents need to beat them in the action and put restrictions on them. How could the ad be changed to test your analysis? I have made one alternative version of this reading the label advertisement. The alternative version takes out of role the purpose of the ad. I left it simple so people could think and hopefully realize that it showed 2 different perspectives, one from an adult and the other one from the child. The false belief method shows that children don't realize that other people don't see what they see, and don't realize that other people don't know what they know. The original advertisement will be easier to understand, as it includes the quote compared to the alternative one without it. The original will be more of a straightforward method to reach out to people and should be the one promoted.